Hi, my name is Olivia Koepp, and I'm a bachelor's prepared registered nurse and a student at Wayne State University. Today, we're going to be talking about the Clozapine REMS program. REMS is a centralized database that both providers and pharmacies use to create safeguards for patients using the antipsychotic drug clozapine. Before we delve into REMS, I want to take just a moment to talk about what clozapine is. Clozapine is a second-generation antipsychotic drug used for those suffering from symptoms of schizophrenia that are not responsive to other antipsychotic therapies. You might know it as Clozaril. Research indicates that 30 to 40% of patients with schizophrenia experience symptoms that are resistant to treatment. Of those with treatment-resistant schizophrenia, 40 to 60 respond to clozapine, compared to response rates of less than 5% to other antipsychotics. Furthermore, clozapine reduces overall mortality by 44% compared to other antipsychotics. Typically, patients have tried and failed on at least 2 different antipsychotics before starting clozapine. I usually describe it to my nursing students in a very simplistic term, as a last resort med. This is because of clozapine's severe side effect profile, the necessary laboratory monitoring, and the need for strict adherence to the medication regimen. The need for strict monitoring became apparent when several deaths occurred due to severe neutropenia, aka agranulocytosis, in Finland, leading to the temporary removal of clozapine from the market. This established the foundation for today's monitoring system, REMS. So what is REMS? REMS stands for Risk, Evaluation, and Mitigation Strategy. It was developed by pharmaceutical companies and approved by the FDA in 2015. It includes all clozapine drugs, and it elevates the standard of care and monitoring to better prevent clozapine-induced severe neutropenia. The addition of united monitoring through REMS has significantly decreased provider reluctance to use clozapine, despite its side effect profile. Carruthers et al. 2022 found that after an initial drop in prescriptions during the transition period, prescribing rates stabilized, then increased by approximately 15% over the next 2 years. The specific lab that's being monitored by REMS to mitigate the risk of clozapine-induced neutropenia is the patient's absolute neutrophil count, or ANC. The ANC is calculated by multiplying the total white blood cells, or WBCs, by the total percentage of neutrophils in the differential. This is done by doing a standard complete blood count, or a CBC. Before initiating clozapine therapy, REMS requires patients to have a baseline ANC of equal to or greater than 1,500. During treatment, the monitoring schedule is tier-based and considers both treatment duration and patient risk factors. According to Bogers et al. 2016, different monitoring intervals based on absolute neutrophil count thresholds can maintain safety while reducing burden on patients and the healthcare systems. REMS in prescribing clozapine is not limited to psychiatrists. Any provider with prescribing privilege can enroll in REMS, including nurse practitioners. Here is a screenshot of the prescriber enrollment form from the REMS website. By requiring those who access REMS to register using specific identification numbers like DEAs and NPIs, provides security for protected health information stored on the database. Once the provider is registered, they can begin enrolling their patients. Here's a screenshot of the patient enrollment form. It starts with their demographic information, then asks if they're currently receiving clozapine, what their monitoring level is, and what their baseline ANC is. This is a screenshot of how the interface may look for a provider once their patients are enrolled. Notice it includes the patient's monitoring frequency, treatment status, and visual cues for when required documents are soon to be due or late. The required documentation is a monthly patient status form, which asks specifically if the patient has experienced any adverse events due to clozapine-induced neutropenia, like infection. It's also where the provider can enter dates and values from the patient's blood draws. The ANC can also be uploaded by the pharmacy. This occurs quite a bit in the inpatient hospital setting. Remember, REMS is a shared database, meaning it is used by both the person prescribing the medication and the pharmacies who dispense it. According to a very recent news article published in Psychiatric News, a panel convened by the FDA voted 14-1 against continuing with REMS requirements after hearing testimony from clinicians, patients, and caregivers. It is unclear what this means for the future of the clozapine REMS program. It's true that clozapine's reach remains suboptimal, and REMS may be to blame. Only about 4% of patients with schizophrenia receive clozapine in the US, compared to 20 to 30 in countries like China and New Zealand. The FDA panel may have a point. As well-intended as it was, it seems that REMS monitoring is creating barriers for treatment in a vulnerable population that desperately need this drug. Despite criticisms, it is undeniable that the centralized structure of the REMS program has streamlined data collection and monitoring. According to Carruthers et al. 2022, the system processes over 100,000 ANC submissions monthly, with an average response time of less than 2 minutes for prescription authorization decisions. Thank you for coming to my TED Talk about the Clozapine REMS program. I hope you learned something.